everyone. I'm here to talk to y'all about the National Patient Safety Goal of preventing pressure ulcers. So what are pressure ulcers? Pressure ulcers are localized injuries to the skin and underlying tissues or underlying tissues that are usually over the bony prominences of a patient, usually caused by pressure or pressure and friction or shearing combination. Who are the ones that are high risk? So we have elderly patients. Elderly patients are at the facility, and they are more at high risk than any other patient we have due to the poor sensation that they experience, the poor mobility, and their cognitive impairments at times. So why are preventing these pressure ulcers necessary? The pressure ulcers are easily preventable using the right measures. Usually pressure ulcers can increase the patient's stay at the facility just due to family members not able to care for them at home. Also, a pressure ulcer can come back onto the facility and cause a liability to the hospital and end up causing the hospital to pay for that pressure wound, such as regional rehab. If we have an issue with that, usually it comes back on us and we pay for it. In an article that I read, it says bedbound patients with pressure ulcers are 37% more likely to die prematurely than those without a pressure ulcer. So I think preventing pressure ulcers are pretty necessary, don't you think? So how will these interventions improve our patients' outcomes? With our patients' outcomes, they will be improved due to the decrease in hospital stay, so the patient's going to be a lot happier when they get to go home a lot sooner. The patient will have no pain because pressure ulcers are painful. A lot of my patients are typically in a lot of pain with the pressure ulcers, especially on the sacral area. The patient's nutritional status and mobility status will be improved. Overall, the patient has a good outcome when trying to prevent pressure ulcers or even treating the pressure ulcers. It will increase the mortality in the patients and also will increase the quality of the patient's life. You wouldn't think just a pressure ulcer could cause all that, but it can. I've seen it. So here's interventions, a couple of interventions that I'm going to go over in regards to helping prevent these pressure ulcers and also treating them. Patients that have poor nutrition, such as low prealbumin or albumin levels, obviously physically poor malnourished, nutrition is a big key into preventing pressure ulcers and treating them. Putting a patient, if they have a pressure ulcer or they are likely to get a pressure ulcer, put them on a high protein diet. Also, you can give them like supplements such as Ensure, Lucerna, and Juven that I've listed here. I know we use this in the facility that I'm in to help with patients who have maybe a really deep wound that needs help being with the nutritional status and boosting that protein level and boosting that good skin to come to surface. Also, there was a study done by Langer and Fink that it showed that supplemental nutrition not only aided in the healing process of pressure ulcers, but also preventing them from occurring. So they used, in their study, they had tested zinc sulfate, high protein diet, and a high amino acid, which would be vitamin C. So nutrition is a huge factor into treating and preventing pressure ulcers. Another intervention that can be used and is definitely key and definitely should be done by everybody is repositioning. Not all patients are able to reposition themselves, so they definitely need our help. So this will be turning the person every 2 hours, put them on a turning schedule. If they already have a sacral wound or if they even have something on the heels, float their heels, move that patient. If they're in the wheelchair, readjust them every so often. Educate the patient, educate the family on adjusting that patient every so often to get them off that bottom so that bottom, their sacral area can breathe and they can start healing and it doesn't have all that pressure bearing down on it. Like I said, a turning schedule and reposition the patient and reminding them and involving them in their repositioning care definitely helps the patient feel more active into their care. Also, it's also important for the prevention of other complications such as pneumonia, immobility, and joint contractures due to patients in the bed too long, you're not repositioning them enough, cause a pressure ulcer. It can cause pneumonia because they're not getting up out of the bed. It can cause somebody to get real stiff and end up causing contractures. So reposition is also a very important thing in preventing pressure ulcers. The last little intervention I have for y'all is the pressure reducing cushion. I know we have at the facility that I'm at, we have several different kinds of cushions, such as a Roho cushion, a gel cushion, just a regular padded cushion that we put in the wheelchairs. We definitely have cushions that we put in everybody's wheelchairs when they come in, just so that they have that relief on their bottom, because they are in the wheelchairs a lot more and they're sitting a lot more than we typically do as regular people. I guess I shouldn't say regular people. When we're not the patients and we're not actually getting up, we're actually getting up as more than the actual patients are. So in this this article I read by Mossman and Hampton, they have this thing called an AeroSpring AS2000 cushion. Sounds fancy, right? So they investigated it and it was indicated for patients that are low to medium risk, and it helps keep the skin hydrated. So it kind of helps, relieve the pressure and leave as far as letting the wound breathe, like I was saying earlier with repositioning. It also is waterproof and it does not cause sweating. Because you got to think, if somebody's bottom or back of the leg or knee or elbow or something, anything, sweating or moisture can cause that skin to be macerated and can cause that a progression in that wound, and we don't need that. We don't need that. We don't need our patient in that, because our patient's going to be in pain and we're not able to help that patient other than with pain medicine, but sometimes pain medicine doesn't even help with that. Like I said, wheelchair cushions a second ago are ideal for the patients who are going to be wheelchair bound or wheelchair bound for a short amount of time even. A pressure ulcer can develop very quickly. You'd be very surprised. Also, there's another form of pressure reducing device. It's called a low air loss mattress. We actually use this today in my facility and place it on a patient due to they had some sacral and buttocks shearing, excoriation, pressure wound. If you have patients with that, a low air loss mattress will be ideal for that. Just it helps raise the patient up, and as soon as the patient moves and repositions herself, or in your repositioning of the patient, it shifts the air and it kind of helps the patient stay off their bottom or whatever area that it is. So I have a case scenario here to go over with y'all. So this patient is Mr. Rogers. He's 89. So this patient came into us with a stroke. He had right-sided hemiplegia. He is experiencing weight loss greater than 20 pounds in the last month. So that's a lot of weight he's losing. And he's already a really frail man as it is. He's 89 years old. So a lot of the older patients are frail as it is. So when Mr. Rogers arrives to the inpatient rehabilitation facility from an acute care hospital to regain his strength and improve his he came to the rehab facility to improve his nutritional status and regain his strength. Upon assessing Mr. Rogers' skin, you notice a red open area on his sacrum due to the poor nutritional intake, and the grade of the pressure wound is a stage 2. Also, with him having a right-sided hemiplegia, he also is going to have poor movement on the affected side. So what will we do? So what could we do for this patient? So this patient, I would definitely provide them with a low air loss mattress like I was just discussing. That definitely can help. And also talking to the dietitian, talking to the doctor too, suggest that the patient be put on a high protein diet. You as a nurse, you definitely can add that to their regimen if you deem it necessary. You can also talk to the dietitian to make sure that they feel it is safe, or if they feel like another nutritional supplement or a higher protein diet protein supplements would be sufficient. Also, we can put a sign above the bed to encourage the patient and to remind the staff to turn the patient every 2 hours to get that patient off their bottom, because it's already it's already a stage 2, so it's already broke the skin. So we don't need that wound progressing any further to prevent any harm or to induce any harm on the patient. because if the pressure ulcer progresses, it can continue the patient's pain, and we can place the pressure reducing cushion in the wheelchair for comfort. Like I said, initially on admission, we put patients in the cushions, just to help prevent the pressure ulcers, because I know I have several patients who sit in wheelchairs a lot during the day, who are immobile, and they complain about their bottom hurting them all the time. So that's why we put the cushions in the chairs, to help prevent that. But this is all I have for you today. I hope you learned a few things. I didn't go over too much to overwhelm anybody, but preventing pressure ulcers is a key thing in nursing. It is a key thing, and everybody knows that in healthcare, that a pressure ulcer can debilitate a patient. If there's any pressure ulcers on a heel, on an elbow or back, any bony areas, that it can prevent the patient from wanting to be moved around or wanting to be mobile as it is. So, and we want the patient to be healthy, we want them to be stable, we want them to have a good nutrition, so we want them to have a good stay at their hospital and get to go home rather than go to somewhere else. So, thank you for your time, and have a good day.